Today I'm going to talk about stomach ulcers. Stomach ulcers. What is a stomach ulcer? What are the risks of developing a stomach ulcer? Who gets them and how do we treat them? Many of us have or know someone who has an ulcer. There are too many people with ulcers who have no idea how they got them or how to treat them. Stomach ulcer. What is it? A stomach ulcer, also known as peptic ulcer, is erosion in someone's gastrointestinal tract. Ulcers are neither cancerous nor contagious but may become malignant. Stomach ulcers disease affects millions of people in America each year. The size of an ulcer may range from between 1/8 of an inch to 3/4 of an inch. When a stomach ulcer bleeds, it can cause a person to experience iron deficiency anemia. What causes stomach ulcers? A stomach ulcer is caused by the destruction of the gastric or intestinal mucosal lining of the stomach by hydrochloric acid. The hydrochloric acid is mainly present in the digestive juices of the stomach. Helicobacter pylori, also known as H. pylori, is thought to be the cause of an ulcer or as well. Although ulcers aren't contagious or cancerous, H. pylori can be transmitted from person to person through contaminated water or food. The risk of developing an ulcer are chronic disorders such as liver disease, emphysema, and rheumatoid arthritis. Anti-inflammatory medications or corticosteroids, improper diet, irregular or skip meals, and stress can be a contributing factor. Now, what are the symptoms of an ulcer? Well, one of the symptoms is pain in the upper part of the abdomen, just below the breastbone, and it comes and goes. So it's going to be like right here. Other symptoms are bloating, retching, feeling sick. There will be times that you might feel full after you eat a meal. In some cases, complications develop and can be serious. Complications can be life-threatening bleeding ulcer, or perforations, which is where the ulcer goes through the wall of the stomach, causing food and acid to leak through into the abdominal cavity. This will cause severe pain and needs medical attention. So now the question is, who can get an ulcer? The answer, anyone can get an ulcer, including children. According to Thomas C. Weiss, around 20 million Americans develop at least one stomach ulcer during their lifetime. More than 40,000 Americans have surgery due to persistent problems or symptoms related to ulcers each year. Around 6,000 Americans, however, die every year from a stomach ulcer related complications. There are a few ways to find out if you have an ulcer. A person can have an endoscopy, a test to detect the H. pylori, and or a biopsy, a tissue cut in and around the ulcer that's taken during the endoscopy. There are a few ways to treat an ulcer. There are a few ways to treat an ulcer, which is triple therapy involving administration of 2 different antibiotics, wiping out the bacteria, antacids, and the third part of the therapy is administration of bismuth subsalicylate. I'm sorry, I don't know how to pronounce it. It's subsalicylate. So, reduction of stress a person experiences. H2 blockers, which is used to reduce the amount of acid the stomach produces. Although there are times when a person needs to have surgery when other treatments fail. So now we know what a stomach ulcer is, what the symptoms are, who can get an ulcer, what the risks are of developing an ulcer. Any one of us can have an ulcer. All we need to do is pay attention to what we are feeling. Don't ignore the symptoms and go see your doctor.